In this module 15, we are going to look at disaster risk management, an important area for managing the risk arising from climate change that we have discussed earlier. Here are the key messages we will go over in the contents of the module 15. Southeast Asia and the Pacific are highly vulnerable to extreme weather events, which are climatic events, and also their related disasters with significant impacts on humans and society. Disaster risk management is a structured process for increasing the resilience. International processes through the United Nations Disaster Risk Reduction Program, which has to be followed for implementing the Sendai framework for disaster risk reduction for the period of 2015 to 2030. Under this, the early warning and response systems are among the most effective aspects for implementing disaster risk reduction. Here is what we will cover in the module 15. Multiple sources of vulnerability to the extreme events and climate events and disasters in Southeast Asia and the Pacific. We'll cover the United Nations Disaster Risk Reduction Sendai Framework for Disaster Risk Reduction. We'll also discuss on disaster risk management and its relationship with climate change adaptation and early warning and response systems. Let us first look at the multiple sources of vulnerability to the extreme weather and climate events and disasters in Southeast Asia and the Pacific. The Global Climate Risk Index 2021, which is for the period of 2000 to 2019, has been developed based on the average values over a period of 20 years. The map summarizes information on the countries which are most vulnerable to the climate change risk in this world. The map also enlists the top 10 countries affected by the extreme weather events, which include the Puerto Rico, Myanmar, Haiti, Philippines, Mozambique, the Bahamas, Bangladesh, Pakistan, Thailand, and Nepal. The Climate Change Vulnerability Index that is described here has been derived based on the 5 aspects. The very first is the historical records of climate related hazards. The second one is the climate hazard maps of 5 climatic related risks, which include tropical cyclones, floods, landslides, droughts, and sea level rise. The third aspect is the population density as a proxy for human sensitivity to climate hazard exposure. The fourth one is the ecological sensitivity of the region, which has been derived using biodiversity information as a proxy variable. A biodiversity-rich region measured by the percentage of the protected areas is therefore considered here as one most vulnerable than other areas to climate hazards, other things being equal. And the fifth one, an index of adaptive capacity as a function of socioeconomic factors, technology, and infrastructure. The map shows the exposure to multiple hazards across Bangladesh, Bhutan, India, Nepal, Pakistan, and Sri Lanka. The map highlights in the darker color the areas which are most affected by various hazards. Hazards experienced in these regions included floods, droughts, extreme rainfall, extreme temperature and heat waves, and sea level rise. The disaster risk management programs, having decreased the number of casualties due to weather related disasters, but the damage and losses in the economic terms and to infrastructure and ecology is high and growing. However, in some instances, disaster risk responses were made difficult due to other factors. These are degraded ecosystems, ill managed land uses, and risk denial by people and communities. In general, though, the resiliency and ability to recover by the people affected by these disasters and the availability of community based support systems provided the best means of coping with these catastrophic events. These maps show the areas of Bangladesh which are affected by cyclones, floods, and earthquake. Nearly all of the country is vulnerable to at least one of these natural hazards. Cyclones are associated with a wide range of health effects also. The figure summarizes these. Crush injuries and drowning are the most common. Now I have a question. What has been your experience with cyclones in your country? By managing the previous cyclones, has any lessons been learned, particularly in your country? Do you think that the efforts of disaster risk reduction with reference to cyclones in your country have increased the resilience? What is your thought on the resilience towards other climatic hazards? This figure highlights the mortality from floods and storms in Bangladesh, with red lines representing mortality from floods and blue from storms. The 1970s and 1980s were deadly. After the 1970 cyclone and independence and building on the early cyclone shelter construction that started in the late 1960s, the government, in partnership with various organizations and civil society, established the Cyclone Preparedness Program in 1972. Working with local communities, a system appropriate to the area was developed to transmit hazard warnings, which included radio broadcasts, use of various color flags, and many more appropriate mechanisms. People were taught to respond accordingly. Cyclone shelters began to go up in the late 1960s and the livestock refuges in the early 1970s. But after 138,000 people died in the April 1991 Eastern Coastal Zone cyclone, the multi-purpose cyclone shelter project began to increase the number of shelters. Each district's deputy commissioner chaired a disaster management committee that included local representatives, elected members, and from non-governmental organizations. In May 1997 cyclone of similar magnitude claims 111 lives, far fewer than the cyclone of 1970. Cyclone shelters have reduced cyclone risk for millions. More still remains to be done. Shelters have space for around 2.8 million people, or 7% of the coastal area's population. The issue is that many of these shelters are not functional, and therefore there is a huge improvement still needed and possible. This is the multiple climate hazard map of Southeast Asia. The most vulnerable regions include all areas of Philippines, the Mekong River Delta in Vietnam, almost all the regions of Cambodia, North and East Lao PDR, the Bangkok region of Thailand and West Sumatra, South Sumatra, West Java and East Java of Indonesia. The table lists the dominant climatic hazards, including sea level rise, with various regions which experience these. Based on the vulnerability map that has been shown in the previous slide 8, a climate change vulnerability index, by averaging each of the normalized indicators of exposure, which is multiple hazard risk exposure, and sensitivity, that include human and ecological sensitivity and adaptive capacity, have been developed. To identify the vulnerable areas, the regions were ranked according to the index and divided the list into 4 equal parts. Those provinces or districts falling in the 4th quartile were considered the vulnerable areas and further classified as mildly vulnerable, moderately vulnerable, and highly vulnerable. In general, these results provide few surprises as they confirm commonly held suspicions that Sumatra is the most vulnerable regions in Southeast Asia, with the Mekong River Delta in Vietnam and Bangkok also highly vulnerable due to their exposure to sea level rise, as is the northern part of the Philippines due to its exposure to cyclones. Central Jakarta ranks first in the overall vulnerability assessment, even though it has the highest adaptive capacity index, because this district is the intersection of all the climatic related hazards except the tropical cyclone. It is frequently exposed to regular flooding, but most importantly, it is highly sensitive because it is among the most densely populated regions in Southeast Asia. Areas in West Java are also highly vulnerable due to exposure to multiple hazards, which includes particularly the floods and landslides, as well as because of the high population densities. This is an orographic map of the Greater Jakarta region, showing the rainfall regions where urbanization has occurred and the low-lying coastal areas. The bottom figure showing urbanization in the 1994 when the flooding occurred, and subsequently this is showing the urbanization level in 2009. So this is the showing the increase of urbanization in this area. As noted in the earlier discussions, a key reason for increase in vulnerability to disasters is there are more people living in the harm's way. One of the drivers is urbanization. These four maps shows the significant change in urbanization in Jakarta, which are shown in red, and the growing area in Jakarta in hectares, which are affected by flooding over time as the city has spread. Urbanization is rapidly increasing in all low and middle income countries, often without the regard to the flood risk. This is especially true for unplanned urbanization. This figure shows flooding in 1994 in Jakarta and what urbanization looked like in 2009. The circle on the right photo shows the building in the left figure to highlight the degree of change that has occurred in the urban landscape. These figures highlight the flood risk to unplanned settlements in Jakarta. The left map shows slum areas and the right map has these slum areas overlaid with a flood map. This is true for many coastal settlements in Asia and the Pacific. The increases in the unplanned settlements are a particular challenge for disaster risk management. Now that we have some background about why disasters are a significant risk to manage in the Southeast Asia and the Pacific, let us now look at a framework for actions in managing disaster risk, the Sendai Framework for Disaster Risk Reduction in 2015 to 2030 period. The Sendai Framework for Disaster Risk Reduction for the period of 2015 to 2030 is a successor instrument to the Hyogo Framework for Action that was for the period of 2005 to 2015, building the resilience of nations and communities to disasters. It is the outcome of stakeholder consultations initiated in the March 2012 and intergovernmental negotiations held from July 2014 to March 2015, which were supported by the United Nations Disaster Risk Reduction upon the request of the United Nations General Assembly. There are four priority actions under the Sendai framework. The first one is the understanding disaster risk. Disaster risk management should be based on an understanding of disaster risk in all its dimensions of vulnerability, capacity, exposure of persons and assets, hazard characteristics, and the environment. Such knowledge can be used for risk assessment, prevention, mitigation, preparedness, and response. Second, strengthening disaster risk governance to manage disaster risk. Disaster risk governance at the national level, regional level, and global levels is very important for prevention, mitigation, preparedness, response, recovery, and rehabilitation. It fosters collaboration and partnerships. The third one is investing in disaster risk reduction for resilience. Public and private investments in disaster risk prevention and reduction through structural and non-structural measures are essential to enhance the economic, social, health, cultural, and ecological resilience for the persons, communities, countries, and their assets, as well as their environment. The fourth one, enhancing disaster preparedness for effective response and to build back better in recovery, rehabilitation, and reconstruction. The growth of disaster risk means there is a need to strengthen disaster preparedness for response, take action in anticipation of the events, and ensure capacities are in place for effective response and recovery at all the levels. The recovery, rehabilitation, and reconstruction phase is critical opportunity to build back better, including through integrating disaster risk reduction into the post-disaster development measures. In the next section, we will focus on the synergies between disaster risk management and climate change adaptation and to see what are the co-benefits and the convergence opportunities. Here we have given the key components of disaster risk management. Risks need to be identified and understood so that the actions can be identified for reducing the underlying risk factors. In the previous slides, we provided an overview of drivers of disaster risk, disaster preparedness, and emergency management are key to reducing the impacts of extreme weather and climate events. Building institutional and financial capacities and resources is important as countries start facing an increasing number of extreme weather and climatic event disasters. The cross-cutting issues are important for ensuring broad buy in the program, linking across local to national scales and drawing the case studies and lessons learned to share with other authorities to facilitate the uptake of best practices. This figure shows the NOVA, that is in Fiji, local to global stakeholders for their disaster risk management. A disaster risk management program began in 2007 and built upon an earlier project to develop an early warning system for floods. The early warning system was implemented following major flooding of the Navua River system in 2004. The 2004 event and previous flood events in the Navua resulted in widespread damage to homes, infrastructure, and subsistence and commercial agriculture. The follow-up project aimed at raising the awareness for the early warning system while at the same time to mainstream the issue of disaster risk management into provincial planning and development process. The local level risk management, that is LLRM approach, was employed, which addresses risk in areas defined by similar natural and physical hazards and not bounded by political or administrative boundaries that often define risk management strategies. This figure shows the local to global partners involved in the project. Many of the major players in DRR in the country and region are involved. The Fiji Red Cross, other non-governmental organizations, technical and academic institutions, and technical inputs from global and other international partners, SOPAC, which initiated the early warning system along with the Fiji Public Works and its hydrology division, and Fiji Meteorological Service, the National Disaster Management Office of the country, the TAF, OFDA for training assistance, and global donors such as Global Environment Facility GEF and the Bureau of Crisis Prevention and Recovery BCPR, which is a body under the UNDP, who also provide technical assistance in devising strategies for implementation. Now, dear participants, I am interested to hear what are the partners involved in disaster risk management in your country. I would be happy if any one of you or more than one of you would like to share your experience from your country. This slide from the project shown on the previous slide highlights the difference and overlap between climate change adaptation and disaster risk management. Disaster risk management has a long history in the region. There has been growing realization that climate change is an urgent issue to which countries need to pay attention. There are increasing efforts to integrate these activities. Challenges to doing so include institutional, financial, and political barriers that inhibit actors and stakeholders from truly collaborating and creating cross-disciplinary programs. Adaptation focuses on climate variability and change only, takes a longer term perspective, is more focused on proactive efforts to increase resilience, and has high political interest. While disaster risk management covers all natural hazards, builds on experience and knowledge, that it generally does not use projections and potential future changes, focuses on extreme events, and has low to moderate political interest. Funding streams also differ. For example, the Global Environment Facility, that's GEF, is a funding mechanism for adaptation formed under the auspices of United Nations Framework Convention on Climate Change, UNFCCC. The Global Facility for Disaster Risk Reduction, GFDRR, is a global partnership between the United Nations Disaster Risk Reduction UNDRR, World Bank, and donor countries that focuses on disaster risk management. However, at the level of implementation, specific disaster risk management and adaptation activities can often be classified as either. For example, mangrove habitats are well known to provide a barrier to coastal risk while also serving as a crucial element of the coastal and estuarine environment. With the threat of rising seas, increased coastal erosion associated with more frequent severe weather, mangroves are also a possible interventions to prepare for additional climate change moderation. And therefore, there are huge opportunities to see the co-benefits between climate change adaptation and disaster risk reduction, and therefore there is a sizable overlap and also offer huge opportunity for integrated implementation and mainstreaming into the developmental planning process. This diagram illustrates that there is a broad area of overlap in the fields of disaster risk reduction and climate change adaptation, although some functional and fundamental differences remain. Differences include, for example, that DRR addresses geophysical hazards such as earthquakes and volcanoes, and man-made hazards including conflict, traffic accidents, and possibly industrial chemical accidents also, while climate change adaptation does not visibly cover these. On the other hand, CCA tends to focus on long-term changes to average conditions such as temperature and sea level rise, and associated risks like sea level rise may cause flooding, erosion, and salt intrusion into low-lying areas. Glacier melt may change water availability on medium to long time scale, as well as the benefits. For example, the new crop types may be cultivated in some areas. DRR, however, tends to be more focused on extreme events only. The main overlap between the two is the management of hydrometeorological or the weather-related hazards. The well-known approaches and tools of traditional DRR, including the Vulnerability Capacity Assessment (VCA) and practical early warning systems, flood prevention measures, and protecting walls, mainly need to be a little better planned and designed and placed, and make better use of weather or climate information in order to become climate smart DRR. And they need to be scaled up to reach more communities affected by increasing climate risk and related disasters. A National Health Adaptation Plan has been developed by the National Institute of Disaster Management under the Govt of India, based in New Delhi, in December 2020 under the National Action Plan on Climate Change and Human Health, specifically for the disaster-related illnesses. Along with this, a training manual on health adaptation and resilience to climate risk has also been designed to address the gap between disaster risk reduction and climate change adaptation. Along this, 5 policy papers on different aspects of environmental health with reference to climate change and disaster risk reduction and compendium of case studies have also been brought out. Now that we understand some of the issues around disaster risk management, let us look lastly at an important tool for managing risk, that is the early warning and response systems. Here in the first two slides, we are providing a synthesis of attributes of and requirement of the early warning systems. Early warning systems are being successfully used in many circumstances to increase the lead time before an outbreak occurs to take the advantage of growing understanding of the association between environmental variables and adverse health outcomes. Effective early warning systems provide needed time to understand actions to prevent number of cases. Strong stakeholder engagement will help ensure an early warning system addresses local needs and constraints. As noted in the slide, there has to be sufficient public health and social infrastructure for an early warning system to be effective. An effective early warning system will provide sufficient lead time for action, be affordable, including in terms of training, give minimal false positive and false negative responses, and be robust, reproducible, and verifiable. Further, the system should be designed so that it can be easily modified as the weather continues to change, and thus changing exposure response relationships or geographical content or the extent of the system, besides many other important factors. The principal components of an early warning system are listed here. Designing and implementing these components requires a range of expertise across different institutions and organizations. I am curious to know how your country is going to applying principles like this to the early warning systems that you have in place, particularly in predicting health outcomes that may arise from climate change related disasters. Therefore, can I ask you to raise your hand if you think your country is doing pretty well in its early warning system? Okay, thank you. You can put down your hands. Then those who think your country, whatever it's doing, there is certainly definite scope to improve the early warning system. Okay, thank you. Now, who all of you think that your country has a strong early warning system in place with reference to health outcomes of disasters? Oh, thank you. Thanks all. We are now going to look at a guide that can be of assistance in establishing better early warning systems that looks at the principles and best practices around the world. We'll be discussing these guiding points so that we understand a framework that is needed to strengthen the early warning system with reference to health outcomes of disasters also. Now, we have a reflection exercise on early warning systems. Within this training, we won't have time to actually design an integrated early warning system for your country or the region. But I would like to ask you to reflect on where you think your country is placed in each of these five components of an early warning system. In the boxes on the notes placed in your folder, please spend 3 minutes giving a score or symbol to each of these five components. Whatever makes sense to you as an evaluation, If you don't know whether one of these components is in place, writing down a question mark will give you an indication of an area for more research and learning when you are back at your work. Is it clear? Any questions? No? Okay. I'll give you 3 minutes to go through this exercise. Okay. So now 1 minute is left. Now you are to finish off your evaluation. Okay. I hope all of you have done it. Now, would anybody like to share the areas they feel their country is most prepared within their early warning system? I can take 3 or 4 responses. Yes, thank you. Thanks everyone. We'll now look at these components in more detail to learn about how they can be implemented. Here it lists some of the issues with using climate information in early warning systems. The spatial and temporal scale of the critical weather parameters need to match well enough with the health data. Appropriate statistical methods need to be applied to the analysis. The analysis must be credible and timely and address key issues raised by decision makers and the public. The analysis should consider all the relevant factors that affect the appearance of a disease outbreak, such as location of vulnerable population, among many others. This graph shows a comparison of the predicted, that is for 97 to 98, white bars, to observe for the same period, cross-hatched bars, and the long-term average for 1965 to 95 in black bars, the rainfall in inches of rain for the major Micronesian islands and Pago Pago, American Samoa. The 1997-98 was the year when the largest El Nino on record occurred. The black bar shows the average precipitation in non-El Nino years, showing the large impact these events have in many Pacific nations. Overall, for the 12-month period, the prediction was very accurate. However, at certain locations, there were some problems in predicting the onset of the drought and in anticipating the return of rains that broke the drought. For example, the onset of the drought was predicted a few weeks too early for Guam, Saipan, Palau, and Yap, and the drought onset was predicted to start a few weeks too late for Kosrae and American Samoa. it was even more difficult to predict the re-establishment of the rains. For example, the drought was forecast to end several weeks too early for Guam, Saipan, and American Samoa, and several weeks too late for Lap, Palau, and the Marshall Islands. Part of the problem in determining the end of the drought is that there was no real definition of the end of the drought. The correlations between El Nino and rainfall were used to prepare nations for expected impacts in the 1997-98 El Nino. Governments developed public education programs, implemented water rationing, identified emergency food and water programs, and other activities. Equally important is developing the thresholds for identifying the extreme events for developing an effective response plan. Such a plan needs to include explicit information and identification of where and when the plan will be implemented. That is, the thresholds for action, what and how specific interventions will be implemented, and to whom the interventions will be communicated. Health professionals need to be an integral part of the team in developing this response plan. Once an early warning system is implemented, there needs to be ongoing monitoring and evaluation of the system to ensure it is timely and effective. The slide lists some of the requirements of an effective monitoring and evaluation program. Now, I have a few questions. Would any of the participants like to share their experiences with monitoring and evaluation plans for early warning or other systems? Also, where there are lessons learned in your country regarding monitoring and evaluation plans for early warning systems. Any insights or any experience that any of the participants would like to share? Excellent. Thank you. When designing an early warning system, it is important to take into consideration the variability in resilience across the region covered. This is an important aspect with example from Dhaka of variability in climate disaster resilience levels. For 10 zones, this slide shows the difference in physical, social, economic, institutional, and natural dimensions. Each dimension has multiple components. The most important parameters were ecosystem services, environmental policies, education and awareness, employment, accessibility of roads, and community preparedness. Most important variables were incorporation of disaster risk reduction and climate change adaptation measures in the zone's development plan. Second one is extent of participation of zone's population in community activities. Point 3. Capacity of zone's health facility to face emergency or the hazardous situations. Fourth point. Total percentage of zone's population living in the proximity of polluted industry or the dumping ground or the sea or the beach. Fifth point, percentage of zone's annual budget targeting disaster risk management activities. Sixth point, existence of an emergency team during the disaster. Seventh, Extent of use of zone level hazard maps in developmental activities. Eighth, awareness of knowledge of population about the threat and impact of disasters. Ninth, extent of support from non-governmental organizations or community-based organizations or religious organizations during and after a disaster. 10th, interconnectedness or collaboration with neighboring zones for emergency management during a disaster. And the last but not the least, the promptness of zone authorities to disseminate emergency information to communities before, during, and after a disaster. An issue often overlooked in disaster risk management response plans is the mental health services. Studies indicate that mental health issues often arise after disasters and can last for months after the event. The slide shows the structure of mental health services in Bangladesh, with self and family care embedded in care and support outside the formal health sector. These are embedded in mental health care through primary health care system, which is within the purview of the community mental health service programs. The study developed and adopted a framework based on the WHO framework in response to the 2004 Indian Ocean tsunami for providing mental health and psychosocial support after disasters. The framework for adapted to Bangladesh post-cyclone and post-flood contexts. The framework is community-based. It includes both medical and non-clinical components, and it could be adapted so that women and the poor are actively sought out and provided for. After training, these services could be run by Bangladesh existing 50,000 strong cyclone preparedness program workforce alongside the country's extensive network of community-based health workers. Post-disaster spending fluctuates more than pre-disaster spending, as shown for Nepal and Indonesia. Governments can help in effective prevention, but struggles to do so. It is difficult to measure how much governments spend on prevention because this is not a specific budget item. Detailed analysis in Indonesia and Nepal found that prevention spending was less than the post-disaster spending. But this does not imply that it was too little, for it is hard to isolate what constitutes prevention and even harder to determine adequate spending. Effective prevention measures are often embedded in other spending. For example, the infrastructure as an embankment. And there are indications that reversing the past neglect of maintenance, that is, painting the bridges to reduce corrosion and subsequent failure, and investing in intangibles, for example, tailing the decrepit structures with large benefits. So, this pattern also highlights that there is often a window of opportunity after a disaster to encourage financing the projects to prepare for next disaster, and this therefore is recommended to be a part of the post-disaster recovery and reconstruction phase. Local level agencies, including NGOs, Red Cross, and the agencies with the local networks like Sphere, IFRC, and others, along with the government at various levels, And other institutions have been working to enable an environment for promoting integrated implementation of disaster risk management and climate change adaptation. There has been significant pilots which involved communities in developing effective warning systems, communication approaches, and putting in place the climate smart disaster risk management systems. National and regional organizations and institutions also play important roles in developing, deploying, and monitoring of the early warning systems as part of the overall disaster risk management framework. Now, I would like to listen from the participants what they think about the local and national early warning systems for their operations jointly with the partners, and how to enable the communities to access the best benefits of these early warning systems for various kind of climate change related common disasters. So to finish off, in the module 15 we covered these topics. There are multiple sources of vulnerability to extreme weather and climate events and related disasters in Southeast Asia and the Pacific. Then we also learned about the United Nations Disaster Risk Reduction and its Sendai framework for disaster risk reduction. Then we discussed about disaster risk management and the synergy with climate change adaptation and their co-benefits. And as a part of the holistic disaster risk management approach, early warning system and response mechanisms. And therefore, from the module 15, the key messages and takeaways are that the Southeast Asia and the Pacific are highly vulnerable to extreme weather and climatic events and disasters, with a history of significant impacts on human and society. Disaster risk management is a structured process for increasing resilience. The international process through the United Nations disaster risk reduction is followed for implementation of the global policy framework as Sendai framework for DRR. And as part of the holistic disaster risk management framework, the effective early warning and response systems are very important components, and to see the health consequences of disasters are included in the overall disaster risk management planning framework adequately. To complete the module 15, I'll ask you to spend the next few minutes looking over your notes and reflecting on the key learnings from this module to you. Please take some notes on any action steps you would like to take once you are back at work based on what you have learned around the disaster risk management. I am sure that you are looking at your notes and you will be finding some interesting areas you would like to take up in your work. Excellent. Thanks. I would be looking forward to hearing some of the actions that you would be capturing over the coming days. Thank you. Now we will have a panel discussion on the theme following Module 15.